The third type of evidence we will be looking at are the interventions that have been used to affect these behavioral and environmental determinants. Most often, these will be health promotion research, usually including an evaluation of the intervention. The main focus of these studies will be what was done to affect a change in the behavior or the health issue. For assignment 1, you are asked to review 5 interventions, so I want to talk a little about the types of studies you should be looking for. Going back to the example of stroke, these are titles that are easily identified as interventions. Stating that it is a randomized control study or trial lets you know right away that this was a research study into the effect of whatever treatment the participants received. Not all articles will be that clear in their titles though, which is why you are also asked to submit abstracts of the studies you identify for assignment 1. The 3 articles here are all interventions, and there are some clues to that in their titles despite not including the words randomized control trial. The first study tells you it is a health promotion program, what type of intervention it is and how it was delivered, and that it was effective. The second study tells you that it was an intervention, what type of intervention it was, that the intervention was associated with improvement in specific outcomes listed in the title. The third title clearly identifies their intervention, smoking cessation, and where the intervention was located, but to confirm that it is an evaluation of an intervention rather than just a description, you would have to read the abstract or the article. Before we move on, I want to briefly share a few examples of studies that, while they can be very important to the development of your intervention and proposal, are not intervention studies, so you will not want to include these types of articles among the 5 articles you review for assignment 1. These type of articles have caused confusion for some people previously, so I thought it helpful to review them here. The first study looks at characteristics associated with the health behavior. No action on the part of the researcher is taken to change behavioral or health outcomes. This type of study is what you would want to include in your discussion of behavioral and environmental determinants. The second and third studies include some of the theoretical constructs we will be discussing during this class, but again is focused on factors associated with barriers, not on the effectiveness of an intervention to reduce those barriers. I also want to point out that qualitative studies often are just used in the formation of deciding how to develop an intervention, but are rarely used in evaluating the intervention. So keep that in mind as you're looking through the studies as well. These are 2 examples of papers that may be written to present recommendations from an organization or group of researchers. Again, they're not evaluating a specific intervention, but are looking at an idea as a whole. The first study listed here is a systematic review. Even if it is a review of interventions, it would not be appropriate for assignment 1 because in that assignment you are asked to review 5 separate interventions. A systematic review or meta-analysis is a more in-depth version of what you will be doing for this assignment. They are looking at multiple studies to evaluate the evidence. Look to these type of articles for examples of structure and as a great resource for your proposal, but they are not an intervention study. The final study here talks about developing the intervention. Again, it probably is not going to tell you whether this intervention was successful because it's in the development stage of the intervention.